Okay, here we go.
Yeah, good evening, everyone. Thank you so much for joining our wellness webinar every week. Today is another day of interesting topic. We will be talking about lung infection, fatty liver, and also pneumonia. So please send out the link to get people to join because it will be a very impactful meeting tonight. Okay, the stuff that we're going to cover today are lung infection, fatty liver, and also pneumonia. Please put your questions on the chat and they will be dealt with as we go along today. Just to introduce Gloriedo Nutrition. Gloriedo Nutrition does bioscan and health consultations. We do essential oils for different things that, we do essential oils for arthritis, blood pressure, and other things that you like to use essential oils for. We also have massage and sleep oils. We also sell herbs and spices, organic herbs and spices. We also have very nice organic hair and skincare products. We do detox program that will help you to lose weight or to gain weight if you wanted to gain weight as well. We have meal plans. We do ready meals. We do cooking classes. We also do nutrition coaching, one-to-one, and also group coaching. So if you wanted to be coached by myself, please contact me and we will set up a program for you. We also have a Food for Wellness scan, which obviously tells us the food that your body requires. And also we do have pain clinic every Saturday from 2:30 to 7 p.m. Today we have a very special guest. Everyone that logs on every week knows him very well. And for some of you, you know him as someone that you've obviously met in the clinic. So today I will be introducing him again. For those of you that have just joined us for the first time, I'm proud to introduce to you Aaron Warden, aka the Juice Doctor. He's a clinical nutritionist, also a natural health researcher, detox specialist, an innovator. He manufactures botanical health products. He's a social entrepreneur. He's a CEO and founder of Gorgeous Detox, Vivo Nutrients, and also MI Healthcare Group. MI Healthcare Group is an umbrella company for other healthcare products and services. We provide natural health solutions, including personalized nutrition, lifestyle change program based on naturopathy, and also integrated functional medicine approach. The Juice Doctor is very passionate about health and is also very passionate about empowering people to know more about their health and how they can live well. His famous quote is freedom through well-being. So that's obviously what he practices and what he preaches. He believes in putting your health in your own hands whilst providing you with the tools, knowledge, and understanding necessary to live a disease-free life. He specializes in detoxification, lifestyle change, and also applies age-old natural health solutions to help you with chronic illnesses and problems that you have had for a very long time. So I'm very proud to introduce him this evening, but before I do so, I just wanted to give you his contact details. So his details are aaronlives@gmail.com. You can find him on Instagram, Vivo Nutrients, and also MI Healthcare Group. The website is MI Healthcare Group or Vivo Nutrients if you wanted to get the products. We also have a YouTube channel called Vivo Nutrients. And also if you would like to book an appointment, you can call the number on the screen, 0207-175-0052. So I'm going to start asking him questions. So the first question I would like to ask him this evening is, what is fatty liver?
Okay, thank you once again, Princess Gloria, for having me on your wonderful platform. And I must say, I've really been overwhelmed and honored and humbled by the phenomenal feedback I've been getting from people that have been listening to the playbacks of the previous Q&A sessions and the actions that they've taken as a result of the information they've received. So it's been really, it's been really heartwarming to see how many people are actually tuning in and actually taking advantage of the information that is being shared. So please continue to do so. Please continue to share this information because it's definitely having an impact and making a difference, which is what we really intend to do. So you said, what is fatty liver? Fatty liver is the accumulation of excess fat in the liver. It's also known as hepatic steatosis, which is one of the most common liver diseases worldwide. Millions of people are affected by this condition, but a lot of people don't actually know about it. Excess fat can accumulate in the liver based on your lifestyle. Lifestyle that has too much good food and, lovely drinks. These are the things that contribute to you developing fatty liver. Now, there's two main types of fatty liver. The first one is non-alcoholic fatty liver, referred to as NAFLD. And the second one is alcoholic fatty liver disease, which is a disease that is attributed solely to alcohol drinkers. But in the majority of cases, it's found that among those who don't drink alcohol, particularly those who are overweight and have diabetes and high cholesterol levels, fatty liver is quite rife. So it's definitely not a condition. So again, it's definitely not a condition you want to have if you're aware. But yeah, that's what fatty liver pretty much is. It's mainly those two versions of a very common condition. In fact, it's one of the silent killers, and fatty liver disease has actually increased by over 400% in the last 3 years.
Thank you so much for answering that question. I have actually seen lots of people with fatty liver, and I saw a guy this week. He was actually very slim. You wouldn't think that he had that sort of situation. So fatty liver, of course, comes as a result of eating lots of fatty stuff. The next question I would like to ask is, how serious is this disease and what are the health risks associated with having fatty liver?
Well, many people, patients and doctors alike, have actually long been complacent, when it comes to diagnosing fatty liver or when it gets discovered, because many think that having fat in the liver is, something that's normal or not associated with any real kind of serious health risks. But it's been shown that people with fatty liver have a much shorter lifespan compared to those without fatty liver. Now, the most common cause of death is actually cardiovascular disease, usually from heart attacks and strokes, but people that have fatty liver are in a very serious disposition for contracting or having that same kind of demise. And this is the reason why people with fatty liver need to be screened for metabolic risk factors such as diabetes, heart disease, elevated cholesterol, and high blood pressure quite early, so they can detect the early onset and take the relevant action before it develops. In the same way that diabetes and high cholesterol can lead to serious heart disease, fatty liver can also lead to serious liver damage. Now, if that fat is accompanied by inflammation with subsequent damage to the liver cells, it can actually cause what they call non-alcoholic steatohepatitis, which is another progression of the fatty liver disease. But if you have uncontrolled diabetes or you have high cholesterol or obesity, you are actually at a higher risk for developing these type of complications. So it's quite a serious condition, and a lot of people may or may not realize that they're actually at risk.
Thank you again for answering the question. I got my first question from Marcia. It says, I have a close friend who consumes alcohol almost every day. Is this an excuse? The excuse is that it's not strong beer. Would that affect their liver?
Absolutely. If you have high amounts of alcohol, even if you have small amounts of alcohol on a regular basis, it's still going to contribute to the alcoholic fatty liver disease, which once it's left, or once it develops and it's left untreated, it can progress further into cirrhosis of the liver, where you actually start to develop scarring of the liver. And then the use of your liver becomes reduced, and the effect it has on the blood is that it leaves you very vulnerable to further infection or further development of disease, including cancer. So it's a very, very dicey place to be if you want to be consuming high amounts of alcohol on a regular basis and deceiving yourself that, oh, it's not that serious, it's not that strong a drink, so it won't have an effect. In actual fact, it does have an effect, because the accumulation of those small amounts or those small units that you may be drinking could result in quite a serious or much more serious condition than he may have at first thought.
Thank you again for answering the question, and thank you, Marcia, for asking the question. Does obesity cause or exacerbate fatty liver?
Well, being overweight and obese is definitely a red flag that should signal the presence of an underlying fatty liver condition. It should also trigger a workup for diabetes high cholesterol and hypertension, these being commonly associated with conditions such as obesity. Now, attention to, having hepatic steatosis or fatty liver is often underlooked or overlooked. This is why we always recommend people to have an ultrasound or a liver function test, even annually, just to find out what your liver status is, because typically fatty liver disease goes unnoticed because it doesn't have any symptoms, and most of the time it's incidentally discovered when you're looking for something else. Now, pain or discomfort around the area of the liver or on the right side of the abdomen is usually not always attributed to fatty liver. So it's always, recommended that you search for other causes of pain just to, make sure and rule out anything else. But the most common blood test, will see and highlight any kind of abnormalities with the liver, and some things that people may experience, maybe things like pain in their right shoulder, which is something that we see quite often with our clients that come in and they discover as a result of them doing the scan that they actually have a fatty liver. So when they're obese, it puts them in a much, much, much greater risk for them contracting fatty liver disease. So obviously the obvious thing for them to do is to embark on a lifestyle change program that will end up with them having or achieving significant weight loss.
Thank you very much again for answering the question. Can fatty liver be treated, and how?
Fatty liver is something that can be treated. There are many ways that you can actually treat it. We actually like to use natural means and natural remedies, because we use a lot of plant-based interventions, those things such as milk thistle. We use a lot of milk thistle because milk thistle is very well renowned for its effect on the liver, and it really helps to support the production of bile, which is one of the main enzymes that the liver produces to really help to break down the food amongst its many numerous other functions. But a healthy lifestyle is one of the greatest, things that you can do or adopt to develop or reduce your chances of developing fatty liver. And if you can discover it early enough, it's definitely very reversible. And the second thing we always recommend is that you try your hardest to lose weight through a healthy diet, coupled with some exercise, some, gaining control of your blood sugar, your cholesterol levels, and making the relevant lifestyle changes. So it's definitely something that's treatable, and there are various modes of achieving this.
Okay, thank you again for answering the question. What causes fatty liver, and who is at risk of fatty liver?
Well, non-alcoholic fatty liver disease, or NAFLD, is the expression of diabetes, also high cholesterol and obesity in the liver. It's the manifestation of the metabolic syndrome. And a big part of this syndrome is the typical non-alcoholic fatty liver disease would be a hypertensive person, or somebody who has high blood pressure, or is somebody who's overweight, or somebody who has high cholesterol. And the things that will cause fatty liver are these underlying conditions, number one, but also if you have a very high fat diet, if you have a lot of processed food in your diet, if you consume, high amounts of alcohol, like the person that asked the question earlier, these can all bring additional pressure and strain upon the liver, and can really help to contribute to a much more negative and adverse situation than you at first would imagine. And the key thing that we really want to stress here is that because fatty liver disease doesn't have any symptoms, it's really important that you're very proactive about your health and trying to find out the status of your liver at the earliest possible opportunity.
Well, thank you so much again for answering that question. And my next question is, will losing weight help treat fatty liver?
Losing weight is always a thing that's recommended. And, it's something that, doctors always, recommend. But there is actually no single drug, known to be better than weight loss and lifestyle change when it comes to treating fatty liver disease. Now, supplements known as liver vitamins, people do try and tout these type of interventions, but there's actually no evidence or any scientific evidence that these supplements or vitamins are effective in treating fatty liver disease. It only gives patients like a full sense of security, and distracts their attention from doing what really matters, which is, addressing their diet, embarking on a lifestyle change journey, and making sure they ingest the right type of foods. So the hardest thing to do is usually the one that works the most. And unfortunately, there is no easy feat, or there's no single bullet or silver bullet that will address all modes of fatty liver disease. But weight loss, losing weight, is definitely one of the best things that will help to reduce the burden upon the liver where it is achievable under safe and well guided measures.
Okay, thank you so much again. The last question I wanted to ask on fatty liver is, how can people with fatty liver safely lose weight?
It's funny, a lot of GPs always recommend, lose weight, or, lose some weight. It's a very overused term, and it's been proven to be the most difficult for many, but undoubtedly it's one of the most effective. But it's something that is always, easily bandied about. Just go and lose some weight, and, you'll get rid of your problems, or it will bring down the burden on your organs. Weight loss is more readily achieved and sustained when it's supervised by a professional, or a nutritional therapist, or a nutritionist, or somebody who's experienced in knowing the impact of a dietary or lifestyle change on your body, and particularly the organ. The extent of your weight loss and the time it takes to achieve the desired ideal weight are also both very important. You don't want to just lose weight drastically and then put yourself in another set of problems. So gradual loss of weight until the ideal body weight is achieved should be the ultimate objective. However, it should also be kept in mind that this goal should be accomplished under the supervision and advice of professionals who know how to deal with fatty liver disease. So we recommend, visiting Gloria Edwards Nutrition, come to visit us at My Healthcare. Anybody that that you have access to that is a health professional that can help you and guide you. It's always better to do things naturally than to embark on a path that's going to be chemical based or chemical led.
Thank you again for answering the question. I'm just going to quickly share my screen just to show people exactly how fatty liver looks. This is how it looks. This is how fatty liver looks, and this is how a healthy liver looks. Normal liver looks like this, and then obviously progresses to inflammation and all the other things that the doctor has kindly explained to us in the question and answer session. So in terms of fatty liver treatment focus points, he's told us already to lose weight. Exercise is very good to do. Eating healthy is also very good. And also you definitely need to avoid carbonated drinks, avoid eating fried foods, high fat foods, and also consider nutritional supplements. These are some of the things that the doctor has kindly highlighted to us this evening. The next set of questions is going to be on sarcoidosis, but before I ask him the questions, I just wanted to just show a couple of things. So in terms of liver cleanse, you could do juice. So you could have a liver juice where you use beets, carrots, apples, and garlic, or you could do one with celery, dandelion greens, parsley, lemons, and that can be drunk at any time of the day. Other things are very good for liver cleanse include carrots, green tea, broccoli, apple, cabbage, lemon, walnuts, beets, avocado, garlic. You could also use olive oil, in terms of when you take your salads, you can use olive oil instead of using the salad cream and all the other things that will cause more problems in your system. Okay, the next session of questions is about sarcoidosis, and this is a disease that causes your immune cells in one or more organs to clump together. These tiny masses obviously causes lots of issues that could affect your eyes, it could affect your skin, it could affect your heart, it could affect your joints, it could affect your brain, it could affect your tissues in your lung, and also cause lots of issues on your skin and enlarge your liver. So I'm going to go ahead and ask the doctor a couple of questions about this. So give me a few seconds. Thank you so much. So first question is, what is sarcoidosis?
Before we go into sarcoidosis, I was just looking through the chat, and I just wanted to make sure we tail off any questions that have been fielded. There were a couple of questions that were in the chat just relating to the liver, and I think one of the questions somebody asked is our scan able to pick up fatty liver? And it's a very good question. Yes, it does. The scan actually looks at and picks up any abnormalities in all of your organs, your liver, your kidney, your digestive system, your bowels, your bones, your blood. one of the things that we're seeing more increasingly is liver fat being very high, and supported by people having problems with their gallbladder also. We find that the gallbladder is producing an inordinate amount of bile to try and support the level of fat that is being placed upon the liver and the burden that it places upon its function. So yes, we are seeing a lot of people with high fat around their liver, and also it's also a big precursor for people that have diabetes, because it's affecting their digestive system. People that have fatty liver often are accompanied with bloating. They're often accompanied with other digestive issues, such as maybe burning in their stomach or heartburn, because sometimes when you have too much acid around your liver, it's going to give you that sort of burning sensation, which will stem from your stomach and sometimes manifest even in your chest. So yes, the scan definitely picks up fatty liver, and it allows you to put the relevant intervention in place earlier rather than later. And another question I saw somebody ask was that, does the liver affect tiredness? It most certainly does, because one of the things that the liver does is that it actually helps the body to produce energy, and it helps to digest proteins. So if you have a fatty liver or too much fat burdening the liver, it will actually slow down the liver's ability to produce energy, and it also slows down the liver's ability to produce hormones, and the hormones are responsible for all the signals that travel around your body, including the manufacture and the production of energy and the conversion of sugar into energy. These are all done by hormones, which are actually produced in the liver. So yes, if you have a fatty liver or a sluggish liver, you will definitely notice a reduction in your energy levels. So I hope that answers the questions for those that were asking in the chat. I want to make sure we didn't overlook or miss any. And please, feel free, if you do have a question as we're going along, to type it in the chat, and we'll do our very best to try and address them.
Thank you once again, Doctor, for answering our question. So the first question again on sarcoidosis is, what is sarcoidosis?
Now, sarcoidosis, again, is an inflammatory based condition. It's mainly found in the lungs, but it's also in the lymphatic system and the lymph glands, and also it can be found in the skin. Now, sarcoidosis happens when small nodules of inflammation or scarring called granulomas can form in the affected organ, and these granulomas can create problems with the proper functioning of that particular organ. As I said, it's not only limited to the lungs, it can happen in various parts of the body.
Thank you again for answering the question. The next question is, how common is sarcoidosis?
It's a very rare, actually, condition. It affects around 1 to 2 people per 10,000 in the UK. So it's classified as a rare disease as opposed to a common ailment. As a comparison, cystic fibrosis affects around 0.7 per 10,000. And Down syndrome also affects around 9 people per 10,000. So sarcoidosis is a very rare condition. It's not seen very regularly, and it's only seen in sometimes small groups of people.
Thank you again for answering the question. I've got a question from Tanisha. She says, can I get rid of granulomas?
It's going to take a lot of work. It's going to take a lot of intervention. It's going to take a lot of dietary changes and lifestyle changes, because you really want to be looking at the reason why those granulomas formed in the first place. And this is why we really have a more integrated approach, which looks at the root cause. We keep the root cause at the core of our investigation to make sure we can identify which systems have gone wrong, or which systems aren't functioning or performing at their optimal level, which would have caused or contributed to these granulomas forming in the first place. So once you've identified which systems or combination of systems have experienced any levels of disorder or imbalance, that will be your first port of call in terms of making the necessary changes, be it dietary, be it hydrationary, be it emotionally, or be it just physical. So whatever needs to be done, or biological, that's where you have to make sure you target your interventions by first understanding what caused them. And once you understand what caused them, or what the contributing factors are towards that situation, then you can start to take the steps to bringing about the relevant balance or order in that particular area.
Thank you again for answering Tanisha's question. Next question is it possible to catch sarcoidosis?
You can't actually catch sarcoidosis because it's not a contagious disease, and there's no evidence either to suggest that the condition can be passed on from one person to another. So no, the short answer to that is no, you cannot catch sarcoidosis.
Thank you very much again for answering the question. So who is affected by sarcoidosis?
Well, sarcoidosis is, it's a slightly more common condition in females. The disease, tends to affect all races and ethnicities, but the majority of the clients that we see are mainly females. And there is some evidence to suggest that sarcoidosis is like more common in specific countries and ethnicities, but it's mainly diagnosed in those aged between 20 and 40 years old.
Thank you very much again for answering the question. So what are the causes of sarcoidosis?
Well, there's been several theories banded around about what actually causes sarcoidosis. None of them have actually been fully proven. Therefore, the actual cause still remains unknown. However, it is generally agreed and accepted that sarcoidosis may be explained as an overreaction within the immune system triggered by an unknown substance. Now, this trigger could come from an external environment or from other internal infections. It could be from virus, it could be from bacterial. But again, the source is unknown, but people are looking at different origins. As we said, we like to look, approach things from a root cause or root issue perspective. But the process probably occurs in individuals who have certain gene types, which means they are more likely to be affected by sarcoidosis if you have, or if you are of a certain gene pool. But yes, there is no specific cause or known cause. That's why they call it idiopathic, which means it's of no known cause, but there are lots of research and investigations being done around the impact of the liver and the onset of sarcoidosis.
Thank you again for answering the question. Is sarcoidosis hereditary? Is it something that I can get from my parents or in the genes?
It's actually a rare occurrence that it runs in families. It's likely to be due to the possible genetic element of the disease if it does happen, but in most cases, it's not a hereditary thing that is passed down from one generation to the next.
Okay, thank you very much. Again, what are the different types of sarcoidosis?
Different types of sarcoidosis. Firstly, it's a multi-system disorder, which means that it can affect more than one organ or system simultaneously. The most common area affected by sarcoidosis is obviously the lungs, which a lot of people are aware of, or most people know about. But it also affects the lymphatic system, including the lymph glands. This is known as pulmonary sarcoidosis, and 90% of sarcoidosis cases are affected in this way. However, the disease can actually affect almost any organs, and about 30% or so of patients will have extra pulmonary sarcoidosis, which affects one or more of the organs other than just the lungs. As you said, there's also liver involvement in up to 70% of the cases, although the majority of people that come with sarcoidosis show no symptoms. But you can have joint sarcoidosis, which affects about 40% of patients. You have skin and eye sarcoidosis, which affects around 25 to 30% of patients. And it's also known to affect the neurological system, the heart, and the endocrine system, and sometimes even the kidneys in about 10% of patients. So there are quite a varied number of types of sarcoidosis, and within that variation, there are quite a few other comorbidities that could also impact the outcome of this particular, or your particular type, or your particular strain of sarcoidosis.
Thank you again for answering the question. So is sarcoidosis a rare disease then?
Yes, it definitely is classified as a rare disease. A rare disease, essentially is defined as one that affects less than 5 people in 10,000, of the general population. And as we said, sarcoidosis affects between 1 and 2 per 10,000. So, 5 being the general marker. So 1 to 2 is way below that marker. So it definitely comes under the category of a rare disease.
Thank you again for answering the question. How does sarcoidosis affect people differently?
There is would say there's not a specific answer to that question, because 2 patients with the same diagnosis can have varying symptoms at different levels of severity, over different periods of time as well. So there are some varying symptoms at different levels, but no two people are alike, so everybody will have a different manifestation of the symptoms, and within those symptoms, there'll also be varieties and variations that maybe the other person doesn't have or doesn't display. So the presence of other conditions alongside sarcoidosis means even more differences can be experienced among different patients. So it's a very complex condition that can vary from person to person.
Thank you again for answering the question. Thank you so much. Please continue to put your questions in the chat as well. And what's the difference between pulmonary fibrosis and sarcoidosis, please?
Well, sarcoidosis is actually known as the most common type of interstitial lung disease, or ILD. The other main type of ILD is known as pulmonary fibrosis. Now, there are a few different types of pulmonary fibrosis, but they all involve scarring of the lung tissue. Pulmonary fibrosis is scarred, thickened, and damaged lung tissue that has lost its flexibility and its function. But the way that sarcoidosis and pulmonary fibroids each affect the lungs is slightly different. Each stage, i.e. you've got stage 1, stage 2, stage 3, stage 4 of sarcoidosis includes the presence of the pulmonary fibrosis in a way that the conditions may overlap in some people. They have what is known as sarcoidosis-induced pulmonary fibrosis, which happens to about 20% of the sarcoids cases, patients which will go on to develop pulmonary fibrosis, but only a small percentage of these are actually fatal. So there's quite slight differences, but also there's a lot of overlapping between the two.
Thank you again for answering the question. I am going to just share my slide again quickly, just to show a couple of things that I think we need to know. Just before we move on, these are some of the foods that you need to avoid if you have sarcoidosis. 1, pork. You need to avoid shellfish, turkey, and lamb. For the fruits, you need to avoid prunes, definitely, sour plums, as well as cherries. In terms of food that you normally eat, you do need to make sure you avoid Maggi cube, avoid pasta, avoid pizza, avoid those crisps that you like to eat. And also you need to avoid some types of beans. This includes lima beans, pinto beans, navy beans, and red kidney beans. These are the beans that you definitely need to be avoiding if you have sarcoidosis. And also in terms of foods that you need to eat lots of vegetables. You need to eat lettuce, cucumber, you need to eat celery, radish, zucchini, cabbage, asparagus, spinach, broccoli, green beans, green peppers. You can have mushroom, but again, you have to be careful. Mushroom is not something that you eat every day. It's something that you probably eat once in a while. You can use a lot of garlic in your food. You can have a lot of ginger. You can have, turmeric. You can have a lot of fruits, and also you can have pineapple. But again, you need to watch the sugar. Jules' doctor was just telling us about the pulmonary disease. This is how it looks in your body if you had that. So of course you can see that the lungs does not look like normal healthy lungs. Just to let you know. We're now going to be talking about lung infection or inflammation. Again, if you do have any questions, please make sure you ask us. When we talk about lung inflammation, we are going to be talking about the different types that there are. So the first question about lung inflammation is, what exactly is lung inflammation?
Right. Lung inflammation is a swelling of the tissues of the lung, most often caused by infection or some kind of viral replication within the tissues. There are a number of causes of lung inflammation that could include things like cystic fibrosis that causes lung damage, and breathing difficulties, which is again based on infections and other symptoms. You also have acute respiratory distress syndrome, or ARDS, which is a severe type of acute lung injury caused by trauma, infection, or other toxin exposure. Asthma is also an inflammatory condition that causes lung inflammation and may be triggered by things like the weather, exercise, allergens, and other factors, which causes lightness and swelling, or tightness and swelling of the air passages, which makes it harder to breathe. And then you have things like COPD, which is a more chronic lung inflammatory condition, which includes things like emphysema, which damages the air sacs, chronic bronchitis, which is inflammation of the bronchial tubes, which also makes it hard to breathe. Then you have lung inflammation and damage that can occur from repeated exposure to irritants and toxins, such as tobacco. Tobacco also causes a lot of inflammation in the lungs. So smoking is always going to be a thing that you want to try and avoid, or avoid people that do it, because even their secondhand smoke will provide irritants for your lung. So there are a lot of different causes and things that can contribute to inflammation, but essentially it's something that happens as a result of infection or some form of toxin that is left untreated.
Thank you very much for answering that question in detail. Is lung inflammation contagious? Is this something that I can get from my neighbor?
Most definitely, it is very much contagious, because some causes of lung inflammation, such as COVID-19, is a very contagious condition. Things like the bacteria from pneumonia or tuberculosis, or viruses, as we said, COVID, SARS-CoV-2, they're all very contagious. And then you've got other forms of infections or contagions, which are caused by autoimmune or genetic causes, which aren't contagious. So, your doctor will diagnose your condition and discuss your treatment plans based on, your symptoms, what you're presenting, and where the infection may have started from, or where it may have originated from. So yes, lung inflammation is definitely contagious and something you want to take very seriously if you do contract it, or you are around somebody who has been diagnosed with a type of inflammation of the lung.
Okay, thank you for answering the question. So what products do you have that I can use if I had lung inflammation?
We have an increasing range of products that we use to help with lung inflammation. Again, once we do the scan will identify and help us to, target the root cause or the root issues. If it is bacterial, or if it's to do with the lack of oxygen, we'll use things like liquid oxygen, because liquid oxygen is a very good product to help increase the oxygen capacity within the blood, and it helps to take the pressure off the lungs if the lungs are struggling with, reduced or reduced amount of oxygen capacity. Having the liquid oxygen really helps to increase oxygen while taking the pressure off the lungs to secrete it and to distribute it to the relevant parts of the blood. We also have a very powerful product called Lung Flush. Now, Lung Flush has a lot of plants that really help to pull blood into the lungs, which helps to reduce the inflammation by providing the relevant nutrients. It also has a lot of essential oils in there as well that helps to clear the airways, helps to remove a lot of the mucus. And it also has some antibacterial and antiviral properties that really help to start to, relieve some of the pressure and the blockage in the lungs at the local site. And then lastly, we have a product called Flu Drops. Flu Drops is a very, very powerful product. We always advise and recommend people to take it prophylactically. Don't wait until you have the flu. Take it to prevent yourself from getting the flu, because it contains things like garlic, it contains things like oregano, it has things like peppermint, it also has hemp seed oil, and it also has black seed oil. So these are quite powerful plants in their own right individually, also along with things like ginger. So when you take the Flu Drops, it really helps to build up a stronger level of immunity by helping to modulate the immune system to have a greater or more aggressive response when it detects any type of threat. So that's why we always say take it before you contract any kind of inflammation, rather than waiting until you have it. So those are our 3 key products.
Oh, thank you so much for answering the question tonight. Marcia is asking the question, can someone with heart problems use liquid oxygen and Lung Flush?
Most definitely. The heart relies greatly on the levels of oxygen, because one part of it is to pump oxygen around the body. So where you may have a heart that's weakened because of one of the pumps or the valves are not working properly, or there's not enough oxygen-rich blood coming back to the heart, where you can increase that level of oxygen in the blood, it's going to always have great beneficial impact on the function of the heart and the way the heart's going to perform its daily function. So liquid oxygen will definitely be something that we'd recommend if somebody is trying to help or improve the function of the heart. But we also always recommend people to use the blood pressure blend as well, which helps to really remove a lot of the calcium that may enter the arteries and cause blockage or accumulation to build up in the heart or in the muscles, which again could contribute to the slowing down of the heart or causing the heart to have to work a little bit harder. So the blood pressure blend is another very good product if people are having heart problems or problems with the function of the heart.
Thank you so much. Marcia is asking a follow-on question. Even if they take other heart medication, can they still take these products?
Because these products are all food-based, they're all plant-based, they're not they're not chemical, they're not synthetic, they're all natural, they're all, as I said, they're food, so the body will recognize them. Just like when you're taking your medication, they often advise you to take them with food. So when you're taking food that has a particular affinity for a particular organ, it's always going to be more beneficial when you have these type of foods in your body or as part of your diet to support any type of medication or medical regime that you've already embarked upon to try and address the product or the problem allopathically.
Thank you for answering the question. Now we are gonna go on to asking questions about lung disease. But before I do that, I just want to share my slides again. Okay, again, oh, okay, that's fine. I will share. I will ask you the questions. So what exactly is lung disease?
Lung disease is a disease that affects the airways, where the trachea divides into smaller lobes called the bronchi, and these tubes will turn into smaller tubes in the lungs. There are different types of lung disease that can affect the airways, and these can be they can be divided, I guess, into maybe three main categories. The first lung disease will be something like asthma, which is a condition that causes the airways to consistently be inflamed, which will lead to wheezing and sporadic spasms and shortness of breath. Also, allergies, pollution, or infection can also trigger asthma as well. Then you have chronic obstructive pulmonary disease, or COPD. This is another type of lung disease that stops an individual from exhaling properly, which causes trouble breathing and can cause a chronic dry cough, or emphysema, which is a condition that traps air in the lungs and makes it hard for you to expel the air and the buildup of carbon dioxide. And then you have cystic fibrosis, which is like a genetic condition that doesn't allow mucus to release from the bronchial tubes. And this can cause a different type of infection in the lungs. So these are like the three key types of lung disease that affect a person's airways.
So is there any product I could take or holistic remedies to take for black lung disease?
There are not any holistic remedies for black lung disease. However, there are many supplements that can help. NAC, and that's like acetylcysteine, can help reduce the chronic symptoms of black lung disease. Also, things like L-carnitine can also be used along with vitamin E, which can really help to ease the scar tissue in the lungs. There are, a lot of herbs, that you can use, things like lobelia, ginseng, mullein. These can help to improve lung function. It can also have an important impact on the integrity of the lung. But the most effective means of dealing with any lung kind of condition is, number one, to have a healthy diet, which has the right type of foods that will support your lung health. And number two, to have a good exercise regime or agenda that can allow your lungs to be exercised, because all parts of the body have muscles. So the more activity you can provide for these muscles, resistance training, is the better they'll be able to function.
Okay, thank you so much for answering the question. Next question is, what is interstitial lung disease?
Interstitial lung disease, it's one of the many different types of lung diseases. These type of lung diseases normally affect the interstitium, or better known as the tissues and space around the air sacs within the lung. This can be caused by inhaling substances or drugs or tissue disorders or infections that cause scarring, and can even cause or lead to cancer. Normally, when there's significant damage to the interstitium, the lung disease can actually end up being permanent. So it's quite a serious condition.
So is restrictive lung disease, and what is that, and how can you treat that? So is that the same as the one that you just discussed, or is it different?
Restrictive lung disease is slightly different. It's a condition where there is a loss of expansion and an increase of lung stiffness within the lung itself. Now, the loss of lung volume can also be from the covering of the lung, or a change in the lung, I guess the texture of the lung, for want of a better word, within the actual sacs itself. Generally, this type of problem occurs when it does happen, it's not reversible, because it's something that's it's quite severe damage that's been sustained, and there are quite a lot of immunosuppressive agents that will be involved or deployed to try and stop this situation from getting worse. It's where they use things like steroids or corticosteroids, among other things, to try and bring this area into order. So they're quite different conditions, but they're both very serious things that will normally affect people at an older age.
Thank you again. Does chronic bronchitis cause fever?
Chronic bronchitis is something that occurs when there's a continuous swelling and irritation of the bronchi within the lung, and this condition can actually lead to difficulty in breathing and could result in the buildup of mucus, which could lead to you having fever-like symptoms. But it's not going to necessarily be the thing that causes the fever, but the condition of the lung will actually lead to your body trying to heal itself, which will result in the manifestation of fever-like symptoms, especially if the underlying issue or cause is viral.
Thank you once again. Tanisha has asked another question. Can eating rice and gluten contribute to lung disease or lung infection?
Yes, directly and indirectly. Directly, because of the metals that are sometimes within rice. These will put quite a burden on the immune system and place a burden on the liver and the kidney, which will impact the flow of blood to the lungs. Indirectly, because of the burden that they'll place on the gut. When you have too much rice and rice continues to cook or to ferment in your gut, it places a burden on the digestive system, which will then have to work extra hard to try and break down this food that's sitting in the gut, trying to make its way through to be evacuated. But also, your immune system is situated in your gut. Over 80% of your immune system is in the gut. So when you have any issues with your lung, the first port of call is always going to be the immune system, and anything that's delaying the immune system from operating or being activated and being deployed where it's needed most is going to have a negative effect on the ability of that particular area to heal or recover from whatever is attacking it. So where you have certain foods that are not necessarily good for you, you've got to be mindful of the effect it's going to have on your immune system, which predominantly resides and is coordinated from the gut. So anything you do, or any cleansing activity that you do or you direct towards the gut, is going to have a knock-on positive effect on areas further afield, such as the blood, the lung, and even the brain. So your gut, whatever you put in your gut, is going to have an impact on a wide level of areas and wide level of aspects of your overall health.
Thank you so much for answering that question. I hope that question was beneficial to other people that are listening. And next question is, what is pneumonia?
Pneumonia is an inflammation of the lungs, and it can strike at any age. Inflammatory states that can cause pneumonia include things like viral infection, bacterial infection, or inhaled particles or liquids, or even fungal infection, because we're seeing fungus playing a big role in the onset of pneumonia quite considerably, quite a lot, and more often on a daily basis. Pneumonia is a very dangerous condition because it reduces the amount of oxygen available within the body. Without oxygen, cells can begin to die. Life-threatening complications can develop in people with COPD, and it can also be fatal if not treated. People with chronic obstructive pulmonary disease and other lung conditions have an increased risk of developing pneumonia. The reason for this is because infections are more common when the lungs are already weakened. So that's what I was saying about when you have the wrong type of foods in your gut, it will put a strain on your immune system's ability to respond to an area that's already weak. So if you're already weak, you want to make sure you watch what you eat and try to keep things like sugary foods or sugary drinks to a minimum. Because if you're trying to recover from any kind of serious infection or serious condition, as soon as you start to add sugar into your diet, it's going to increase the replication of that particular bacteria. So sugar feeds bacteria like no other drug. So try and keep the sugar content really low when you're trying to recover from flu or COVID or any type of inflammatory based condition. Other risk factors include an immune system that isn't working properly, or if the body is less able to filter viruses and bacteria out of the air, which is something that's done predominantly by your tonsils. So if you have, weak tonsils, or you're always having tonsillitis, these are going to have an impact on your body's ability to recover from pneumonia. That's why it's such a serious condition, and it normally happens at the end of life, when all those systems have been pretty much overloaded as a result of your diet and your lifestyle or your dietary choices.
Thank you again for answering that question. Next question, how long does pneumonia take to clear?
Well, it depends on how severe your pneumonia is. As a general rule, after 1 week, the fever should have resolved. 4 weeks, the chest pain and mucus production should have substantially reduced. After 6 weeks, the cough and the breathlessness should also have substantially reduced. But we've seen cases where people have had pneumonia, and they've said because it's quite severe, it can take them up to 3 months for them to recover, because they were really very, 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 very progressed. It was quite a serious case, and it was very advanced in where it was when they actually caught it. But when we added in our lung interventions, we used the flu drops extensively at a therapeutic dose, which is a slightly higher dose than normal. We used the lung flush. We also used the liquid oxygen. We also added in the respirate, which is things like the essential oils. Then we added in lung flush. We added oxyflush to really cleanse the gut. Because we supported multiple systems, that particular person was able to recover and make a full recovery within about 4 weeks, because she had all her systems very well supported. But generally, they would say from 6 weeks to 3 months.
Thank you once again. How would I know if I have pneumonia?
Well, the first thing you've noticed is that you find it very hard to breathe. Other symptoms include, shortness of breath that continues to get worse, a sudden inability to be able to catch your breath. You'd feel very congested, and you'd feel that for, a considerable amount of time, maybe longer than a few days. You may be coughing up an unusual amount of dark yellow or green mucus. And when you look at the color of your mucus, it's really important to note that the color of the mucus that you're coughing up will determine the level or the stage of the infection, or the level or the stage that your immune system has been able to mount a response. If it's white, for example, you're fully infected. Your immune system hasn't even started yet. If it's green, then you can identify if it's bacterial or if it's viral. When the mucus becomes yellow, that means your white blood cells have been able to mount a good enough response, and they've now started to attack the pathogen, be it viral or be it bacterial. And now your body's starting to eliminate those cells that have been taken back and retrieved from the virus or retrieved from the bacteria, and now your body will start to cough those out. So when you start to see the phlegm turning yellow or the mucus turning yellow, that means your immune system is starting to get on top of the situation, and you're probably a few days or maybe at most a week away from making a full recovery. So try and increase your fluid intake to make sure you can bring a lot of that mucus out, and to really give your body the tools that it needs to eliminate the intruders once and for all. Other symptoms may include fever, you may have chills, you may also have ongoing fatigue. But if you think you have pneumonia, we definitely recommend for you to see your GP.
Thank you again. So how long do you think it takes to fully recover from pneumonia?
As you said, it depends how long. While everyone's recovering from pneumonia varies, you're likely to be feeling better within a few days of starting the right treatment with the right interventions. The doctors will always, first point of call, prescribe antibiotics. If you are going to take antibiotics, we'd always recommend that you take it alongside some probiotics to make sure any bacteria or good bacteria that have been damaged can be replaced, and replaced quite quickly, because that's also going to be something that will determine the level of response that your immune system will be able to mount to be able to bring that situation under control.
Thank you once again. So why do you think it takes so long to recover?
Almost everybody that comes down with pneumonia will ask themselves, or their healthcare provider, at least once, why does it take so long to recover? After all, you might feel better within a few days of starting your antibiotics, if they give you antibiotics, or in some cases they may give you steroids. But like everything else in medicine, and importantly, natural medicine, there are many reasons why it may take so long to recover. It depends on when the bacteria enters your body and your body goes into that defense mode to remove it. If you're sleeping, if you're getting the right amount of sleep, that's going to determine how quickly your immune system can, mount the right amount of tools and resources to mount a proper attack or proper response. People don't realize how important rest is when you have any kind of debilitating condition. Your immune system works extremely hard overnight because it releases a lot of inflammation to tell the immune system that these are the areas that we need to bring the white blood cells to, bring the natural killer cells to, bring the T cells to make sure that the body has the tools, the relevant tools to mount the appropriate response. But when you don't get enough rest, your body doesn't get the opportunity to accumulate enough of those cells to be able to stave off the production or the reproduction of the invading pathogen or the invading bacteria, which will also be replicating at a very rapid rate. So you need to make sure you get the right amount of rest, because that will also have a significant impact on the time it takes for you to recover. Your bodies also will start working overtime to clear out all the trash left behind. Your body will use multiple mechanisms and multiple systems to remove the mucus out of your lungs. And this movement of the mucus is why you'll be experiencing a productive cough. So it's very important that you're aware of that. There's many things that you can do to speed up this process. And the more you know, is the more you'll be able to support your body's response to pneumonia and these type of serious lung conditions.
Thank you once again. And last and final question, can you give us an example of the timeline for recovery? They said within 7 days. If you just give us quickly an example.
Well, the cases that we've seen quite severe pneumonia, and we've seen quite mild pneumonia. Quite mild pneumonia, you can, pretty much turn it around within 7 days. If you have quite severe pneumonia, it depends if you have other, comorbidities with it or other co-infections that are also present at the same time. That could determine how long it will take for you to recover, and it could actually contribute to taking a much longer time. But my classic example is that we will generally aim to bring any pneumonia, no matter how severe, under control, generally within about 3 weeks, because we're going to really use and target all of the systems. We're going to employ all of the mechanisms of the body. We're going to employ all of the healing mechanisms and all the healing systems and the innate immune systems that are available to make sure that they're functioning at their optimal level. So generally within 21 days, we've seen people with pneumonia make a remarkable and quite full recovery.
Thank you once again for answering the question. So what products do you have or do you sell that will help with pneumonia?
Well, when we're dealing with pneumonia, the first thing we always tend to start with is the gut, because we really want to, engage the immune system and remove anything that's blocking the immune system from, operating at its optimal level. So we'd always start with Oxyflush. Oxyflush is one of our top selling products because it really helps to clear the colon of any undigested or unevacuated waste, which will be producing a lot of toxins that will give the immune system a lot of work to do, and could sometimes overburden the immune system and delay the response in areas that it may need it, especially in cases of pneumonia. So we'll definitely start with Oxyflush to really cleanse the colon and free up a lot of those immune cells to go and attack whatever's happening in the lung. Then we would use the Ultra Detox, because the Ultra Detox has things like milk thistle, it has dandelion, it has burdock. It has a lot of plants that have an affinity for supporting the liver function, supporting the kidney, and supporting the digestive system as a whole. So it almost tonifies those organs to function more effectively, so they can help in removing or isolating a lot of the toxins or a lot of the bacteria from the blood. And then we would engage things like your Respirate, which has all the essential oils, a very, very powerful essential oil product that has things like lemon, has all the citrus fruits, has eucalyptus, has peppermint, that really helps to break up the mucus in the lung to really help to increase your breathing capacity and to allow more oxygen to flow into the area. Then we'd use things like liquid oxygen. Liquid oxygen, again, as we said earlier, it helps to increase the levels of oxygen in the blood, which again takes some of the pressure off the lungs when they're trying to provide oxygen to the blood. And then we'd use the lung flush. As I said, the lung flush has a lot of plants, like things like mullein things like marshmallow root that really help to coat the lining of the lung and to stem off any kind of inflammation, to help to encourage and to speed up that healing process within the whole of that lung or respiratory environment. So we do employ quite a number of different tools, but the respirate, the ultra detox, the oxyflush, the lung flush, and liquid oxygen are always our first port of call. And then we may add other things like silver to help to kill off some of the bacteria, and then maybe things like SOS, which have some very powerful antiviral properties that will really bring the battle to a much speedier close. So yes, we do have a wide range of products that we use, but when we put them together, they are often very effective at bringing pneumonia into submission in quite a reasonably short space of time.
Thank you so much, Doctor, for your time this evening. Thank you for answering all our questions.
My pleasure.
We are here again next week. I'm just going to share my details once more. We're here again next week. So these are some of the products that the Juice Doctor talked about: lung flush, oxygen. You could use uplift, you can use respirate, and also the oxyflush. If anyone would like to contact me or to ask any questions, from next week, I'm going to be talking about sugar inflammation and also how sugar affects your body. So next week, we're going to talk about that. I will send out a message as well for sugar detox. So if anyone wanted to join the sugar challenge, no sugar for 30 days challenge next month, please feel free to contact me on 0798-455-1292. You could also visit my website, gloryedwardorganic.com. And my Instagram pages are Glory Edward Nutrition, Glory Edward Organic, and also Chef Imani's Kitchen. In Chef Imani's Kitchen, you get to see all the lovely foods that I make and I eat for myself. I do not eat rice, by the way, and I do not eat pasta either. But there are other nice foods that you can eat that will help reduce inflammation or also help with your lungs as well. Thank you so much, everyone, for joining us tonight. We will see you next week, same time. God bless you. Have a lovely evening, everyone.